Hey guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about Meloxicam, also known as Mobic. Very commonly prescribed, very easy to take. There might be some scary stuff I say, but again, most people take it. What is it for? It's for anything having to do with osteoarthritis, rheumatoid arthritis, any sort of musculoskeletal issues. I know I've taken it in the past because I've kind of messed up my upper back, weightlifting, to any kind of inflammation, any kind of like tissue injury, or even, knee injury, elbow injury, whatever. It's like a very, very strong Advil or an Aleve. Just prescription strength, a lot more potent. You have to take it with food because it will upset your stomach like any NSAID does. So remember, an NSAID is a non-steroidal anti-inflammatory. And so if you have or ever had an allergy to aspirin, then this might kind of co-interfere with that and kind of cause that issue. So you may want to watch out for that, let your doctor know about it. Really, it's either taken once a day or twice a day. Very easy to take. Again, you just take it with food because, again, it could cause acid reflux issues in your stomach. So if you have acid reflux issues, make sure your doctor knows, because if you're on this for about 2 weeks, you're going to see that acid reflux really kick up in that time. It does have a black box warning, so like I said, it might get a little scary, but for anyone who has heart conditions of any kind, you do want to watch out for this medication. Make sure your doctor knows. Could cause issues with MIs, strokes, or a coronary artery graft, bypass graft, a cabbage, not the vegetable, the cardio term. And then also at the same time, it could cause GI bleeding. So if any of those things are kind of in your background, you need to let your doctor know, especially if you have pre-existing sort of heart conditions. That's a big one. And again, like I've mentioned about acid reflux being a big one. So it can also cause GI bleeding if you're on it for a very long time. So just make sure that your doctor's aware of any pre-existing conditions. And for the most part, most people tolerate this just fine. If you have liver issues, same thing, or if you take a lot of medications that go through the liver, this also goes through the liver, so make sure your doctor also knows, because you don't want to tax your liver by taking too many drugs that go through the liver. It's excreted through your urine and your feces, so if you have sort of any renal conditions or you're on dialysis or something, make sure that your doctor also knows, which your doctor should know, but a lot of times when you go to multiple doctors, not everyone knows what you're on. So that's why it's always on you to make sure that you're letting your doctors know all the different ones you may have, the 2 to 15 doctors you got, that you're on these medications, so that they all are aware and they're all on the same page. Because if you're all on the same page, that's where everyone gets better. People don't get better, and medicines do harm when you're not everyone is on the same page. If doctors are prescribing stuff and they had no idea that this was going on, and this doctor prescribed something that this doctor had no idea was going on. So just try to simplify it and also keep everyone on the same page. And I think that's it, guys. It's, again, really, really easy to take. Generally kicks in and lasts almost all day. I think its half-life is about 12 hours. Don't quote me on it, but I think it's about 12 hours. So it's got a very long mechanism action. Do not pop this stuff every 3 to 4 hours or something like that. No, like 1 a day is usually good. If you're on a lower dose, the 7.5s, then you could maybe be on that twice a day. But generally, you take 15 milligrams once a day, and that's it. But again, every doctor is different. They all have a different way of doing things. So, guys, I think that pretty much does it, right? We had Meds Made Easy. We try to keep it real quick, easy, simple, and fast. So I hope we did that. If you have any questions, please leave us some comments below, and we'll see you next time on Meds Made Easy. Bye.